Ooh, I see you brought your parents too. Hi, mommies. Hi, daddies. I am so excited to be here with all of you. Yeah, I know this past year has been very, very hard. But my mommy said that there are so many people who have been helping one another. And she said that there are lots of wonderful people who are helping all of you. Yeah, you know what? I think your neighborhood sounds a lot like Sesame Street. And that's very special. And I think you are very special. Adios, amigos of Baltimore. Mwah! I love you. Adios.
Hi, everyone. Thank you for joining us. That was a lovely introduction from Rosita on Sesame Street. And we are going to spend the rest of the hour talking about all things related to early childhood. So I'll need the slides to come up. Tonight was brought to you by the Children's Cabinet at the Mayor's Office for Children and Family Success in the Early Childhood Work Group, which has several partners. Two of which help to facilitate this evening. So the Baltimore City Early Childhood Advisory Council and the University of Maryland School of Social Work at the Institute for Innovation Implementation. My name is Margaret Candelaria and I work at the University of Maryland School of Social Work. Next slide, please. Oh, I forgot to say, para español, haga clic a la interpretación. So we're fully translating it. You just have to hit the interpretation button at the bottom on the right. Why are we focusing on early childhood? Well, there's a lot of reasons why, many of which are our smallest citizens in the city. Next slide. But we like to think in terms, I'm a researcher by training, so we like to think of in terms of 5 numbers that really get at some of the science behind what we know about the importance of early childhood development. Next slide. So children actually develop and grow 700 new neural connections per second in the first 2 years of life. So every interaction that a baby has with their caregivers, their families, and their neighborhoods, basic things from cuddling and feeding and bathing to how they interact with in childcare and in their neighborhood, are growing all of these neural networks at a very, very rapid rate. So all of those early years of experience are really important for early childhood development. Next slide. We also know that by 18 months, we start to see differences, particularly in verbal development. So all children are born with the same capacity. There's no fundamental difference really, but we do see that depending on risk factors they're exposed to or environments they grow in, we can start to see these differences very early on. We also know we can address those differences really early on. So we want to be able to invest in programs that help early childhood development. Next slide. We also know that for kids who have developmental delays and challenges, 90 to 100% of them are experiencing some other kinds of risk factors that contribute to that. Next slide. And relatedly, we also know that by the time we're adults, there's a 3-to-1 odds of having an adult heart disease if you've been experienced to multiple risk factors in childhood. So our early experiences in life impact us for a long time. However, we also know that if we invest in programs in early childhood education and helping families early on, you can have a $4 to $9 return on that investment. So that means that for every dollar we can invest early on in the early years before kindergarten, we see a return in that in terms of less costs related to crime, special education, welfare services, more people employed, more people paying income taxes and things like that. So it's worth every penny to do it now, to do it during the early years. Next slide. I know there was a whole town hall at the mayor's office around toxic stress and trauma, but just really quickly, some stress is really good for development. We do have to learn to manage a little bit of stress, and we learn that through the interactions in our family. What is tolerable stress? You have a move, you have a new sibling, you change schools, things happen in your family, and that's fine. But when there's a lot of intense levels of stress that are chronic and you don't have periods that allow you to recover, it's what's called intolerable toxic stress, and it actually does impact brain development. So all of those neural networks I showed you earlier, you have fewer of them, and there are fewer in the front part of your brain that is actually where we learn as adults to regulate our emotions and manage our behavior. We also know that adverse child experiences, when I said, being exposed to these risk factors early in life, it's related to elements of child abuse and neglect, and household dysfunction. So having family members that are struggling with mental illness or other things like that. But it's not that all is lost. Families have negative experiences, and we can help. Next slide. So there are protective factors that help families and young children, and most of that is through nurturing relationships and stable environments. And families are protective, to their children, and that protective factor is increased by having access to supports and services in their community. So this picture on the right is a classic diagram by Bronfenbrenner, who is a very early developmental researcher, that shows that children are really developing within the interaction of these systems within their homes, schools, churches, libraries, and then the larger community and neighborhood, and then even the policies and systems in our larger society. So if we can actually help families have access to services they need and have neighborhoods be safe, then we can, make sure that our children are having the best chance at developing well early on in life. Next slide. So it's really a matter of pay now or pay later. So, it's really worth the investment to focus on young families with young children that can start prenatally, through the age of 8 and on, focusing on forming safe, stable, nurturing relationships. That includes not just parents, but grandparents, childcare providers, the people who care for children, preventing the effects or mitigating and intervening on the effects of toxic stress on children and families, and remembering that it's less costly and more effective than late stage interventions. Next slide. So the Children's Cabinet actually has 7 areas of priority. Increasing early childhood development and getting kids ready for kindergarten is one of them. But you can look at these statistics and why they have focused on these other 6 areas of reducing food insecurity, reducing experiences of homelessness, making sure children have increased literacy skills in high school, less impacted by trauma, less engagement in the juvenile justice system, and obviously less loss of life due to homicide in our city. All of these outcomes are actually rooted in early childhood. So we all fully support addressing all of these needs right now, we also will reduce all of those statistics in the next decade or so if we invest in early childhood, helping families and childcare providers now. Next slide. And just a parting message to remind us all that the emotional well-being of young children is actually related to the emotional functioning of their caregivers and their families. So we can't just help kids, we have to help their families and the people who take care of them. And with that note, we're going to talk to some parents and talk a little bit more about community resources as we move forward. Our next speaker is a parent, and he's going to talk about the challenges navigating early childhood systems during this pandemic that we've just experienced, and his name is Klaus Pharrell.
Good afternoon, everyone. Good afternoon. Thank you, Margot, for that introduction. So definitely those slides provided some information that I wasn't even aware of as far as parenting and things like that, and that just goes to show that, no matter where you are in your stage of life, parenting is going to be a challenge. There's always going to be a learning experience. And that's something that I carry with me on a day-to-day basis. So necessarily parenting as well as a male, for number one, as a single father, and also as a single parent has been a challenge, and it also has been an experience, an enriching experience, because it's taught me a lot of great things and a lot of beneficial things that I can instill in my daughter. But it still posed its own set of obstacles and challenges and things of that nature. My first challenge, and which was my primary thing that was keeping me, holding me back from being able to grow into things of that nature, was that I was a homeless individual. I was homeless for exactly a decade. So when my daughter came about in my life, I was still going through that transition. And through that time, it was hard enough for me to find resources for myself to be able to take care of myself. And that was enough of a stress on an everyday basis. But having to look at, you know, myself at the capacity of being a provider, at being a father, at being a dad, I knew that I had to go far and beyond more than just myself. And so that's what started my journey into looking for assistance and looking for resources for me to be able to better myself, but also be able to provide for my child at the very same time. Being homeless, I required a lot. I required food for myself not only, but also I need to procure finances for my child. Um, Initially, the idea of getting childcare vouchers or child support was a idea that was brought to me many of times. Personally, though, I have never sought out that route because I feel as if the requirements for that was something that I was not able to do. One, having, you know, the other parent on child support was that was a really rough ask from me, considering where I was in my life, but also where her mother was in her life, at that point in time in her life. And neither of us was good off to be a providing parent. So child support was something that it went out the window. Being able to get some financial support from the government was something that wasn't necessarily easy for me, considering the fact that I am a single father, and most of these programs or most of the services they support more of single parents, whom are mothers. As far as finding programming and things like that, for getting resources for single fathers was something that I was not knowledgeable of, and I did not know where to go to find these resources. And any other place that I went to try to find these resources, they weren't able to point me in the right direction either. So with that being said, I had to trudge through the hard way. And don't get me wrong, I still struggle to this very day. I still struggle to put food in the house. Well, honestly, that's actually my biggest struggle these days is putting food in the house. I had to make a lot of life changes in order to support my daughter and myself in a productive fashion. She's 5 years old and she's turning 6 this year. So obviously this is like a really big point in time of her life where she's growing, she's learning. Like there's a lot of things going on with her. And I need to be able to provide for her the best way that I can. And necessarily I'm doing it by myself. I'm not doing it with assistance. We've all heard the tales of like being a single parent's tough, being a single parent's hard. And and these are all stories that come from single mothers. And then that by itself is a struggle. But coming from a single father, and seeing the struggle from a different perspective because of my gender it's a bit of a shell shock, you know what I mean? Because it's the fact that that there are services and things like they're out there to help individuals in your situation, but they're not tailored for individuals in your situation. You know what I'm saying? Like they're made for single mothers and their families. Like they're not generally made for single fathers and their families. And that's also something else I've noticed. Like as far as like I don't know, as far as like I'm not originally from Baltimore, so as like far as like straight state traditions or policies or things like that, if I'm not mistaken, it goes that the mother is like what is it? Traditionally the primary caregiver. If the parents are separated or something of that nature. I may be foggy on that fact. Don't get me wrong, I may be foggy on that. But it was to my understanding these past couple of years that it was always the mother that was looked at first as the primary caregiver, and this father comes second. And then being in my position as the primary caregiver, I felt like a lot of these services weren't tailored for me. They weren't made for me. And so that was also a discouragement for me to try to be able to like go out and just receive these things, to get these things. But no, nevertheless, that doesn't discourage me from trying. That doesn't discourage me from looking for avenues. Now I'm in the point of trying to get my daughter into education, and that's proved to be its own set of a journey. You know what I mean? I have to, navigate the systems to try to get her personal information, such as birth certificate, social security card, immunization records, things of that nature. And all of that is very new to me. This is not stuff that I was ever given a folder of know-how or given a class of this is what you need to do, things like that. It was never an explanation for me. So it was always definitely a tough come around, but it's still something I'm working through today.
Klaus, thank you so much for sharing that. And we're going to have some time at the end for question and answers, but I don't mean to cut you off. Was there anything else you wanted to say before we bring on our next speaker?
Oh, no, absolutely. No, you're perfectly fine. Go for it.
Okay, great. So thank you so much for that. Our next speaker is also a parent. Her name is Alicia Burnett, and she's also going to talk about maybe some of the successes that she's been able to achieve during this past year.
Hello. Can you all hear me?
We can hear you just fine.
Okay, because my video is going in now. During COVID, it was kind of difficult for me to get my vouchers cut back on, just due to the mailing process is really hard, getting everything in. But Joshua, my children do go to Joshua's place, and with the help of Miss Imani, I was able to get my vouchers cut back on. Also, it was really tough for me because my son has a speech condition, and it's just really hard right now to get any type of speech help because of COVID. Them even coming out to the center has been super hard for me. So one big thing that really helped me was actually having the support from the center. They backed me behind everything that I've tried to accomplish. So that's been a big help for me. But it was really, really tough in the beginning with just trying to get vouchers because we all were kind of panicking. It was what to do when they cut them off. It's been a long process just due to my mail was coming late. We were going back and forth with the vouchers just because they didn't know if we were going to get approved or not. So it was really rough. So in the beginning, it was a little harder than I expected, but again, with the center, we've really been able to overcome it. It was just kind of concerning because I work a full-time job and it's hard to kind of get around I have no transportation, no public transportation. So without honestly Joshua's place, I don't know how I would have got anything accomplished. They really helped me. I've actually was able to schedule picking my kids up with them and everything because I had no clue what I was going to do once this pandemic happened. And I am an essential worker because I'm a CNA, so I have to go to work. And it was just very, very, very overwhelming. But we actually were able to overcome it. A couple resources that I've gotten help with probably were with my son, my oldest son's child care and his speech development probably was early. I think it's early infants and toddlers. They were able to kind of help me somewhat with his speech problems. So that was a big help. Right now, it's just kind of hard because he's at a certain age where he's still a toddler, but he's kind of outgrowing that, the infants and toddlers. So Miss Imani has been a big help to help me find other resources for him so they could come out to the center and, help us out. But so far, it's actually been going better than I expected just due to having the help I really needed. But at first I was super nervous and I didn't know how I was going to get able to get through this pandemic with being, a full-time mother and a full-time worker. So it kind of made me super nervous to know, was I going to still be able to get my voucher? Because you never know, if you work, if you're going to be able to get it or not. They might say you make too much or you don't. It's kind of flip-floppy with it. But like I said, again, our daycare center, Joshua's place, has really helped me a lot with every aspect and really been a big support for me being a single mom of two toddlers. But that's all I have to say. Thank you.
Thank you for sharing. And it sounds like just having the stable childcare and a provider who was really willing to spend time with you and figure some things out for your family has been really important.
It's been very important. My first time my kids have actually went to school, well, a childcare center was Joshua Place, and I'm very that overbearing, protective mother. And with actually with the director Imani being a nurse, I feel super, super more comfortable to the point where she'll come out and even come to my house if the kids are sick. She'll call me and say, "Hey, do you need me to stop by?" So being a single parent and being around a younger, because I'm a younger age with going to school, because I'm actually want to go to nursing school. She's been a very positive role model, and my kids adore her and love her. And I really don't know what I would do without her.
Yeah.
Give me a second, I'm on a meeting. Without her, backing me in everything. So
I mean, I know Imani. A lot of people on this webinar tonight know Imani, and she's very special, and you're very lucky.
She's very special. Yes, she's a very special woman. She's blessed us in so many ways where my vouchers have actually been cut off. Excuse me, I'm talking, thank you. Where my vouchers actually have been cut off, and she has still worked with us. And like I said, I would never take my kids out of there. My son has a very bad speech problem, but my daughter's too, and she talks perfectly fine. So that's been a really big challenge for us as well. And I mean, just the improvement of my 5-year-old and even my 3-year-old is ridiculous from them just being there. So like I said, I don't know what I've done with this pandemic because I had no clue until they actually stepped and helped me. So.
I love how you have really highlighted the importance of stable childcare and being able to maintain those relationships. And I think a lot of providers are just as committed as Imani around the city. It's actually the perfect transition to our next speaker, who actually is a childcare provider. So I'm going to transition on to her. But thank you so much for sharing your story. So our next speaker is Trina Powell. She is the owner and the director of the Walter P. Carter Child Center, and she's going to talk about what childcare has been like from the provider perspective during the pandemic.
Great.
Just hearing, good evening, everyone. Just hearing Klaus's and Alasia's story just makes me smile because it speaks to the work that we do daily. My name is Trina Powell, and I am the director of Walter P. Carter Child Care Center. I'm also a member of the ECAC, which is the Early Childhood Advisory Committee, and I am the president of the Baltimore City Child Care Coalition. Today, I will be speaking to you regarding childcare providers and the work that we've been doing during the pandemic. Just like everyone else, the pandemic was rough for us. The COVID-19 changed the landscape of childcare in Baltimore City, as it did for much of the world. Along with first responders, city childcare providers were forced to exercise extreme flexibility and fight through their fears and care for the smallest citizens of the city. Most centers in the city never closed. They have been on the front lines from the beginning and aided first responders through the EPIC program that was developed by Maryland State Department of Education. Next slide. COVID into childcare. What we face as providers. As providers, we faced a few obstacles. We face financial obstacles. With the Maryland State Department of Education, they have been more than wonderful in helping guide centers through the process of just making sure we had the right protocols to make sure children were safe in the city of Baltimore and the state of Maryland. But with reduced capacities brought upon financial issues for a lot of centers. A lot of centers, unfortunately, were not able to survive because we had to deal with a lot less children, which is fine because we want to make sure everyone is safe, but it did, impact the bottom line for a lot of providers. Another issue for us has been, of course, for providers is recruitment. And, we like to keep and have wonderful childcare providers in our centers that are warm and nurturing, and we'll provide the service that we speak to and that Alasia has had, or and the Klauses of the world and all the other parents that we interact with on a daily basis. So recruitment, of course, has been difficulty, and we are working very vigilantly to get more persons interested in the childcare community because it's a very rewarding career. And our next thing has been childcare subsidy, which I heard Klaus and I also heard someone else speak about. Just making sure that parents are able to get into childcare and have being able to afford it and getting through that whole subsidy system has been one of those issues that we as a community are working towards, and working with Maryland State Department of Education to try to overcome some of the barriers so parents are not having so many hindrances in getting into childcare. Whenever you speak to parents in the city, that's probably one of the biggest hurdles for them to overcome, is getting subsidy care or getting vouchers. And oftentimes, parents, like Klaus spoke to, they feel that they have to put a child, the other parent, on mandated child support, and that's not always the case. But a lot of parents hasn't heard that from the program. So that's one of the things that we need to get out there loud and clear, that is not always true in getting child care subsidy. But the length of getting subsidy is a problem for parents in the city of Baltimore. Next slide, please. Our successes. One of the lifelines that child care providers had during the COVID-19 was the Family League of Baltimore. They were able to give a lot of the centers in the city and the family home providers, they were able to give them funding through the city. And that has been a lifeline to most centers and most family child care providers. And if it had not been for the Family League of Baltimore, a lot of providers would not be open. So we are most thankful for them. And of course, the Paycheck Protection Program, which was a hit and miss for some providers, but overall, it was one of those pluses for us. And I could not say anything more than the great women and men that care for the children daily. I've had employees for years, but to put themselves on the front line, because they were just as much as frontline workers as everyone else. And they came to work daily, and they came throughout the entire pandemic and worked through their fears, okay? The involvement of childcare during COVID-19. As I stated earlier, the Maryland State Department of Education has worked very diligently to make sure that childcare is safe in the state of Maryland. And so with that, of course, we've had lots of enhanced protocols with hand washing and temperature checks, and where parents have to engage in temperature checks, and we're making sure our centers are safe by not having any extra traffic. We can't have any outside vendors now, and it's just teachers in the building. And we're working, most centers are working with smaller numbers. So those things, along with a ton of other regulations that have come down since last March, help us keep children safe in the age of COVID-19. And you know what? Those practices have become very helpful. And I feel like a lot of centers feel like they're in a much better place because of the new stated rules for COVID-19. Technology. That's probably been for parents and childcare providers. Childcare providers are not technically the most technology savvy people, but we have learned to become better, especially me today sharing my screen and my slides. So I feel very accomplished today. But technology in childcare, we've had to learn to use it a lot more in the COVID age. And so we're making sure our students are on their calls and on their Zooms, and making sure they're in their Google Meets to make sure that they're in school every day. Also, we're communicating with parents more so over technology in the age of COVID. So these things have been enhancements to our programs, as a lot of providers have had to get more computers, more bandwidth to make sure we can meet the needs of the families and the children of Baltimore City. I don't want to speak a whole lot about everything, but we have, like I said, the providers in Baltimore City that I hear from quite often, being the president of the Baltimore City Child Care Coalition, have worked diligently to make sure that the children of Baltimore City are safe, fed, educated, and well taken care of. We pride ourselves in the work that we do. And when I hear Alasia speak so highly of Miss Imani, I hope that a lot of parents will do that of their providers, because I tell you as a provider and as a director, we work around the clock to make sure that we are providing the best service to the children of Baltimore City. And along with partners like the ECAC, Maryland State Department of Education, I don't want to start naming, but the Family League, they help us to continue our work, in the Baltimore City Child Care Resource Center. I could not forget Nancy and her staff. They help us provide services and educate our staff and make sure that everyone is doing the best job that they can for the citizens of Baltimore City. We want to keep our children safe and in our centers. And if anything we can do, we'd like to hear from you. Thanks.
Thank you. Thank you so much for that very detailed and comprehensive presentation. Our next speaker, and then we're going to have some time for some question and answer, is Laura Wheeldrunner. She's the Executive Director of the Maryland Family Network, and she can answer a lot of questions about all of these childcare logistics.
Hi, everybody. Thank you so much for inviting me to be a part of this. I am totally inspired by the stories of parents and providers tonight, because this has been such a difficult and unprecedented past year. So you've heard little snippets from people. Parents have dealt with chaotic and, ever-changing situations. They might be working from home one day. There are parents who've lost jobs. Their childcare was closed in the spring. Then childcare reopened, but parents might have felt unsure. Is it safe? Should I send my kids back? Schools have been closed in Baltimore. And here we have providers, these amazing community resources and leaders in the early childhood space who are suffering from a catastrophic loss of revenue. And worst of all, young children have potentially missed out on an entire year of their stimulated learning development. So everyone is, holding on and doing the best that they can, but everyone is worried. As you probably have experienced, tons of services have moved online. Home visiting, early Head Start, lots of childcare has moved services online. But to be honest with you, there is no research that says that online interaction and services are effective for our youngest children. It's just too new to know what really works and what makes all those neurons connect and develop that Margot talked about earlier. So Maryland Family Network, we are a statewide nonprofit organization, and we work on behalf of young children, their parents, and childcare providers, early childhood educators. Those are kind of the three constituents that we think about and attempt to serve through our networks around the state. And in the fall, we've done some surveying. We've done some surveying of parents, and we've done some surveying of childcare providers. So I want to try to give you some numbers to help you conceptualize how challenging the past year has been. So you've already heard Trina say most childcare providers are under enrolled right now, and that's what drives people's revenue is enrollment. It's very simple. So why aren't children in care? So when we surveyed parents in the fall, we found that 41% of parents had health concerns and safety concerns because of COVID-19. The good news is that research out of Yale University has shown that childcare is not a super spreader event, and that childcare providers have been fastidious and meticulous in implementing safety and health protocols. Really, I think we know that childcare providers were really good at health and safety even before there was a pandemic. So although it is totally understandable that parents are scared, there's also a lot of evidence to say that childcare is safe. The second biggest reason we heard from families is that parents are working from home. So also, they might have older children who are at home. So why pay and take your younger children to childcare every day when everyone else is home? Closely linked are the third and fourth highest reasons, and that is the cost of care, which can be prohibitive, and parents, one or more parents have lost their jobs. So obviously, those are linked together. These are real challenges, and again, honestly, these can be challenges even outside of a pandemic. So let me talk about what's going on for providers. Providers obviously suffered tremendous losses last spring when childcare was closed, as we struggled as a nation to understand COVID, how it was contracted, how it was spread, and what we could do. So childcare was closed unless you were approved to be open for essential personnel for several months, which again, financially devastating. Now that childcare has been reopened since last summer, their providers are facing a double whammy. And what is that double whammy? It's decreased enrollment at the same time as they have increased costs. So why decreased enrollment? For all the reasons I just shared with you, that parents are nervous, they may not be financially positioned to send their children to care, or they may be home because they've lost their jobs. But what we know from our survey is that around the state, providers are losing an average of $8,511 every week, every single provider. And that is a total of $9.6 million lost per week by childcare providers just in Maryland. So that's dramatic. Take that in for a minute. The second thing is that they are facing increased costs. And so at the same time that they're losing revenue, they need to spend more money. Well, why is that? They need to pay for PPE. They need to change their staffing ratios to accommodate parents not being allowed in for drop off or pickup. They need thermometers to take temperatures. They need masks for young children who don't understand not to lose their mask, not to chew on their mask, not to drop their masks on the floor. You probably have all experienced in the last year, there have been real shortages of things. At some points over the past year, providers were struggling just to find milk, much less bleach or Lysol wipes or any of the other kind of necessities of 2020 and 2021. So providers reported in our statewide survey that their costs have increased $5,339 per site per month to cover these new costs. So you can do the simple math and see that childcare is hanging by a thread right now. And to that end, in our statewide survey, 49% of childcare providers believe that if this pandemic goes on another 6 months, they will have to close permanently. And in that same scenario, 33% of childcare providers say that they are facing no choice but to increase tuition and their fees. So I think we all know that things are opening back up. The president has said maybe by July 4th, fingers crossed. But what we are going to face imminently is how can parents return to work? How can the economy reopen? How can school resume in person if there is not enough childcare? Childcare providers are the workforce behind the workforce. And we have seen this in other countries around the world that at times, especially over the summer, for example, or late in the spring, when businesses widely reopened, parents immediately came in and said, I need to take leave because I don't have anybody, anywhere, any place to send my young children who cannot be home alone. So I don't want to end on a down note. I want to end with some hope. If you are a parent and you need help finding care for your young child, I want to give you a few things to feel hopeful about. First of all, the federal government, the Biden administration and Congress have passed the American Rescue Plan, and there is $502 million coming to Maryland for investments in childcare, which will include $300 million of which will be direct grants to providers. So for these providers who've suffered terrible financial losses, there is more financial help on the horizon. That's good news. Also, you've heard tonight that childcare is under enrolled. So if you need help finding care, you can use a service that is free and statewide that Maryland Family Network runs called Locate Childcare. There's a link to it in the chat, and I'll put another link in shortly. You can call Locate Childcare and actually work with a live human being, rare these days, who will help you figure out your exact needs and what available childcare exists for you. We also have a searchable online database if you want to do this on your own time frame. Our counselors are in the office from 8:30 to 4 p.m. answering your calls. If you call after that time and leave a message, they will call you back. The second thing is you've heard folks talk about childcare scholarship, or sometimes people call it childcare subsidy. There is a page on the Maryland State Department of Education's website with all kinds of information about childcare scholarship, including the application, where to call for help, some information about the process of applying for childcare scholarship. There are requirements. For example, families have to be working and you have to meet certain income requirements, and then you have to find providers who take childcare scholarship, which Locate can help you do. I don't want to mislead you into thinking this is an easy or overnight process. It is challenging, and I am sure that providers like Imani or Trina here on this call will tell you they spend a lot of time hand-holding families to fill out childcare scholarship paperwork, because it's a lot of forms and a lot of back and forth. But don't give up. There is money that can help you pay for childcare, and Baltimore has seen our numbers go down over the last couple of years in terms of the number of parents who are taking advantage of this. So we really want to make sure you know that that is there for you. All right, I am wrapping up, and I'm happy to answer any questions. Margot's back on the screen.
Stay on for one more minute, because we're getting some Q&A questions over Facebook and here in the chat, and some are for you to answer. So one question was, what was the percentage of child care centers and providers that didn't make it through the impacts of the pandemic in the city?
I don't think we know that number yet. It's complicated, but the truth is, when you compare, many of you will have children who are in school and in childcare. The thing is, childcare is not organized into a system the way schools are. So what we know about childcare is often really lagging data. We don't collect enough data. So places like the Baltimore City Child Care Resource Center can probably give some pretty educated guesses, but we won't know for sure until this is all over. Okay. I see Trina has said in the chat,
Trina has said
17% has been lost. And look, that is so challenging. You might think like, oh, 17% doesn't sound that bad. It's bad, because there are entire communities in Baltimore City that were already childcare deserts before the pandemic.
Right. We don't have enough childcare slots to cover all the families in need as it is. So we can't afford to lose any.
Correct.
One more question for you, and then I'm going to try and direct some questions to our parent panel. But it's around childcare, like scholarships, subsidies, vouchers. We hear all of these terms thrown out. Are all of those the same thing? And as a follow-up, where do you get information about them?
Great question. Yes. Voucher, subsidy, scholarship, all mean the same thing. It is confusing, no question about it. I am going to put a link in the chat right now for how to find information about scholarship, subsidy, vouchers. So let me do that.
So while you're doing that, I would just ask Klaus and Trina and Alicia to come on camera, so that as we direct some questions to you guys, you're ready to go. And Laura, just as a follow-up, as you're to the subsidy question and where to find it is, I feel like these parents that spoke today spoke so lovingly and wonderfully about their providers who helped them.
Absolutely.
But what do you do if you're not yet connected to a provider? Or how do you, where'd you go for help if your provider is new to the subsidy program as well?
Great question. I wish there was a super clear answer on that. I mean, one thing you might do is call locate and try to get connected to a provider, because Trina will tell you, or Imani will tell you, they do a lot of hand-holding of parents to get through the subsidy process, including crazy things in 2021, like faxing documents. I mean, who has access to a fax machine? Trina probably has a whole list of like horror stories about the process. It is like any bureaucratic government process. It's not super personalized. It's hard to talk to a human being, but you can get help. I mean, there's a bank of people virtually, of course, sitting somewhere answering questions about subsidy. You have to be patient and realize it's not going to get approved overnight. Trina, what advice do you have for parents? I'm sure you have other tips from the field.
Chime in.
Yes, I've been asking them to hire me on the subsidy branch, but because I do
support that.
Yeah,
you might have some people here that could think about that.
Yeah, absolutely. I do assist a whole lot of parents, and we have gone from faxing to helping people scan and email to make sure they have documentation. So I've started to teach our parents how to use their smartphones to upload information to the system, because it is you know, like you said, it is bureaucratic. And so you need documentation to say, yeah, I sent that. So to try to alleviate some of the back and forth, how do you get assistance? CCS, you can call the CCS hotline. They have a 1-866 number. I don't know the number exactly. We can put it in the chat.
Okay.
They do have a number where you can speak to representatives at CCS, and
Just
they
the
will.
CCS stands for childcare.
Childcare subsidy.
Scholarships?
I'm sorry.
Right.
Childcare scholarships.
Okay.
Yes,
So
that is
everyone be clear.
the new name, and there is a website for childcare subsidy. We'll put that in the chat as well. It's
I
money.
think it's already in there. Somebody already
Money-
put it in
Yes,
there.
it's called
I
money.
just put the 866 number in, Trina.
Yes, and moneyforchildcare.com is our website for the state of Maryland to get straight to the subsidy program.
Great, thank you. We had one more question related to childcare, and then I have a question for the parents. But the question is, does childcare locate help childcare for children with special needs? I know the answer to that is yes. I just wanted to lift up the question because I think that is really important, and there are families who want specialized, whether it's healthcare or developmental support, and that information is in child locate.
Yes,
right?
we have counselors who are specially trained to serve families who have children with disabilities, and they actually get a higher level of what we call concierge service. So absolutely, we also have Spanish speaking counselors and a translation service for multiple languages. So do not hesitate. These folks are so knowledgeable about childcare all over the state. This is not just Baltimore City, it's all over the state.
Yes. So I know we've spent a lot of time talking about childcare, and it's huge. It's hugely important for families with young kids to be successful. But I also know that there's a lot of other services that families need to access when your kids are younger. And I didn't know if the other Klaus or the other parents wanted to talk about what were some of the other services. I know we've talked a little bit about housing. I personally, as somebody who's been a clinical provider and now do research, I have found it frustrating that we ask parents to go to all these different places to get all the different things, right? And so maybe if you parents could talk about what's been easy to access and what's been hard to access, and those of us listening could learn from that.
In my experience, things that are done online is a lot easier because it doesn't require me to bring my daughter in tow. Bringing her along, like, of course it's possible, but that just adds extra effort to everything that could be avoided. So like doing things online is a lot easier, or doing things by phone has been a lot easier in my experiences.
So like Trina was saying, sort of enabling smartphone usage to access services. Alasia, did you have anything you wanted to add about hard or easy to access services or other things that helped your family or you still need?
I think hard things for me to access probably have been help with getting food stamps, any type of food supplement. It's been hard for me just because the income they look at, they don't hold all the income accountable. So that's been hard for me. They just look at they look at your pay before they take out taxes. My difficulties have been, in that aspect where it's like they'll look at my income before maybe I'll have a $1,200 check. They don't really look at as far as how much they're taking $400 out my check, and I still have a $1,200 rent to pay and 2 children who I have to still pay a copay on, and stuff like that. So I feel like that's probably been harder for me. That's probably been a hard thing for me. And honestly, for me, it's actually been the opposite way of, is that Klaus? His name Klaus? It's been the opposite way for me. It's been online has been harder for me. It's been harder for me because like I work full time, to make ends meet, to get the bills and everything paid. So I'm working constantly. And it's like, okay, when I go online to do these things, I feel like I'm not really understanding it. And I might call the service line and they're like, well, you got to do it this way and that way. So for me, that's been harder. I actually rather just a paper application and going to social services and getting that help, where they can help you fill it out.
So the option to do it either.
Yeah. And since everything's been closed, it's been really hard even just getting an appointment to go down there. So I haven't had food supplement for about a year now. So I've been spending like $400 dollars a month on getting food. Guys, excuse me. Yeah, just food. I'm sorry. Just getting food.
Appropriate. This is why we're here.
Food for, the house. So that's been hard
Yeah.
for me. The only thing I can say has not been hard is been getting the daycare vouchers. That's been, a
Great.
little bit easier with the help, because I actually have help doing it from my center. But other than that, as far as the social services, it's been really hard. And even getting Section 8, the waiting list is so long nowadays. So
I think that I think it's very well connected to the rest of the mayor's office for children and family success cabinet, children's cabinet agenda items, right? Because food insecurity and having access to enough food is also one of their priorities, as is homelessness. So, I think that the experiences that you guys are so openly willing to share tonight with this audience is relevant for many, many people in the city, and I think we're grateful that you're sharing them.
Oh, thank you. It's no problem.
So I think if I don't see any other questions going on in the chat or on Facebook. I'm multitasking a little bit here. We do have one more speaker who is from Sesame Street. She's going to make a special announcement. Her name is Rochelle Haynes. She is the Vice President of U.S. Social Impact for Sesame Street.
Great, thank you so much. First, I really would like to thank the Mayor's Office of Children and Family Success and the Baltimore Children's Cabinet for inviting me to be here this evening. It's been a delight to be here, and I'm grateful to be here to learn more about how children and families are navigating in Baltimore during this time, especially during the difficulties of this past year. As was mentioned, my name is Rochelle Haynes, and I'm representing Sesame Workshop and a program called Sesame Street in Communities. Sesame Street started in 1969 with the big idea to make school readiness and preparedness, such as ABCs and 1, 2, 3s, accessible to all children. And what was great is we added the fun of the lovable Muppets, Big Bird, Elmo, Cookie Monster, and all the friends on the street to make learning fun and engaging. Our mission at Sesame Workshop is to ensure that all children grow up smarter, stronger, and kinder. Our goals are to promote the importance of early childhood development, the importance of investing in the early years, and raising awareness of the needs of young children, which very much aligns with everything we've been all talking about and learning about here tonight. We do this work domestically through our Sesame Street and Communities initiative, where we focus on early childhood development and offering resources to help children and families, especially navigate through adverse childhood experiences. Those experiences could be anything from the death of a loved one, parental substance use. We're dealing with foster care and the transition of that and how to talk about that from a child's perspective, homelessness, as well as food insecurity. We have all of this amazing content that we created, and we house it on a website called Sesame Street and Communities. It is a free bilingual website and is geared for parents, caregivers, and providers to use to help kids and help families, again, with ABCs 1, 2, 3s, healthy habits. We're teaching mindfulness techniques. And again, how I mentioned earlier, how to manage through those difficult times. And with this past year, we've rolled out new material called Caring for Each Other. And with Caring for Each Other, it's really how to manage through the pandemic, how to talk about it with young children, how to help them have some sense of normal and a new normal with these routines we now have. And we also just recently launched material on racial justice and how to talk about race with young kids, how to talk about our differences. And we'll be rolling out more material on that to really also help children understand how to be upstanders in the face of racial injustice. It's a company-wide commitment, and you'll be hearing more about that from us over the next couple of months. All of our work really is to focus on how do we make sure children are resilient? How do we make sure they have the skills to manage through those small as well as big life moments that we're all grappling with? But the most important thing is we do it in an age-appropriate way. The site includes over 30 different topics in those buckets I mentioned, and we have video games, we have coloring sheets, articles, and all other activities that are meant to be done with both the adults as well as the kids in their lives. And it's really an opportunity to create nurturing connections and have those conversations together. And we have videos that will model how to have tough conversations about big topics. For us, it's all about how to offer a sense of safety and security, coping skills, and most importantly, help kids feel like the adults in their lives understand what they're grappling with. And for the providers, and I love that tonight we were shouting out all the amazing childcare providers. We can't even do what we do without the amazing providers out there. And you all are true heroes of this pandemic. And so for providers, we include free professional development on our site in the forms of trainings, webinars, as well as videos. Another big goal of our work is to actually directly partner with communities and organizations across the country. This is the pleasure that I have of leading that program, where we deeply embed our materials in programs that are serving kids and families. We are in 13 locations, including Baltimore, which I'm deeply excited about. We have the pleasure of right now partnering with the Family League of Baltimore. With the Family League of Baltimore, we've trained staff on how to use our Sesame Street and Communities material, and it's currently being used in both their home visiting and family recovery programs, again, focusing on building resiliency skills. We are beyond excited to continue that partnership and to even expand it to reach more kids and families in Baltimore. And even here tonight, I have some ideas on how we can continue to support the work that you all are doing in early childhood development. And so I want to thank you all again for having me today. I'm deeply excited to be here. Please visit our website, which I'll also drop in the chat. We're excited to continue to work alongside all of you on making investments in early childhood development and providing resources and supports to kids and families in Baltimore. Thank you again.
Thank you so much. Our next presenter is Ashley, and she has giveaways. Ashley Bush with the Mayor's Office.
Hi, everyone. I'm Ashley with the Mayor's Office of Children and Family Success. I wanted to just quickly say that we do have some giveaways for parents that are on the call. We have funding towards a week of childcare. We have Lakeshore Learning gift cards. We have 2 of the Day I Beat the Germs books, which you'll learn a little bit more about in just a second. And we're also giving away a bedtime in a box. So thank you to all those who have filled out the questions during registration. We're also going to give everyone another opportunity to enter the raffle for giveaways. I am currently putting in the chat box the link to the survey for everyone to fill out. So the survey will close in 24 hours. So we're asking that you fill out that survey in order to be entered into the raffle for the giveaways. The winners will be selected by a random drawing generator and will be contacted via email. They'll also be listed in a follow-up email to all town hall attendees. Thank you so much.
Thank you, Ashley. Those are great and amazing giveaways. So our last speaker for this evening is Nerissa Holger Hall. She is the author of The Day I Beat the Germs.
Hi there. I'm so excited to be here with everyone. My name is Nerissa Holger Hall, and tonight I'm excited to share a book that I just wrote called The Day I Beat the Germs. But before we get into the story, I wanted to share a little of the background story. Last spring, like many of you on the call, I was quarantining with my husband and our 2 kids, 4-year-old twins, in our apartment. And like every other parent, I was searching for a way to explain COVID-19 to my kids in a way that was truthful, but not too scary. And since, we already had this understanding of the importance of washing hands and that got rid of regular germs, we decided to talk about COVID-19 in terms of being the new germs. And so one day, my son, who was 4 years old at the time, came to me and said, "Mama, I have an idea. I'm going to build a giant vacuum and lower it all the way down to the sidewalk and just scoop up and vacuum up all the germs." And I was really struck by how he was trying to gain any agency that he could muster to try to solve sort of the problem, the predicament that we were in, because we didn't know how to really stay safe in the early days of the pandemic. And so that idea from my son about the vacuum became part of a story that I started to tell to my kids to help them understand the pandemic. And so I used my experience working in children's media for the past 15 plus years, working with Nickelodeon and PBS and on Ready to Learn projects funded by the US Department of Education, to publish this new book called The Day I Beat the Germs. And for parents, my hope is that this book helps your kids make meaning and make sense of the past year and, frankly, the way that we live now with masks and washing hands and making sure to keep our distance. And for providers and educators, the feedback that we're getting is that this little book really helps reinforce and remind little ones of those CDC recommendations in a way that is, age appropriate and understandable. And so right now the book is for sale on maramarabooks.com, and you can use the contact button to, order directly. And so it's my pleasure to share the book with you now, and enjoy the story.
So Narissa, before we show the video, I skipped making some announcements. I'm sorry to pause you. I just want to thank everyone for coming. After I make a final announcement, you're going to hear this book, and it's a beautiful bedtime story to end the evening. But we just want to make sure that everyone knows that the next Children's Cabinet Town Hall will be June 14th at 6 p.m. and it will focus on boys and young men of color. So we hope you enjoy this little story time as a way to end this evening with your little ones, and thank you all for coming.
Hi, my name is Nerissa, and today I am really excited to share a brand new book with you. It's called The Day I Beat the Germs. Are you ready to read with me? Okay. The Day I Beat the Germs, written by Nerissa Holder Hall and Heron Atkins, illustrated by Beatrice Mutasa. My best friend and I love to play. We see each other every day. We play and laugh in the house and all around. We play and laugh till the sun goes down. But now new germs are everywhere. I can't play with my friend, and it's just not fair. I miss my best friend now that playtime is done. I wish I could do something to bring back the fun. Oh, I've got it. I'll get rid of the germs so we can play. But how to do it? I'll think of a way. I know. Just like we used to clean my room, I'll suck up the germs with a big vacuum. I'll take all the germs to a faraway place. I'll pack them all up and send them to space. They think they're tough, they think they're strong, but a giant hairdryer will get these germs gone. Wait, what if the space plan doesn't work? Or if the dryer runs amok? What if the vacuum can't reach all the germs it needs to suck? Then someone wise knelt down low and told me to my face, I don't need a vacuum, a hairdryer, or even outer space. If I do just 3 small things, I will keep myself real safe. Wear my mask when I go out and wash my hands well. Keep space between myself and others. And that's all there is to tell. Now I know to bring back the fun, I don't need magical tools. my friend and I can laugh and play while following the rules. Even though the germs might think they're really, really clever, they'll never, ever outsmart us if we all just work together. I hope you enjoyed the new book, and feel free to visit miramirabooks.com to order copies directly. And what's special about Mira Books is that every book comes in 14 different versions, so the child in the book can look a bit like the child in your life. Thank you again.